So our project is on teenage pregnancies and adverse child outcomes in the U.S. Our group members are Kelsey, Morgan, Hannah, and Raven.
So just for some background, in the United States, there are roughly 7,500,000 teenagers that become pregnant yearly. And in the South, the lack of comprehensive sexual education and a focus on abstinent-only sex education results in this region contributing largely to the number of pregnant teenagers in the United States. After a teenager becomes pregnant, there are many barriers that can prevent them from accessing the prenatal care that they need. Socioeconomic status, amount of support from families, and societal stigma are just a few aspects that could greatly reduce when and if prenatal care is pursued. And in the United States, only about 70% of teenagers receive the proper prenatal care within their first trimester. So pregnancy during teenage years can result in a variety of outcomes impacting both themselves and their child. First, complications during pregnancy and childbirth can result in trauma to the mother, as well as an increased risk of mortality to the infant within the first month of life. Low infant birth weight and higher risk of SIDS is also pretty common. And socially, teenage pregnancy can alter familial relationships and friendships, which can even further increase emotional burdens. And then stress in mothers can be caused by monetary burdens, more responsibilities, and just social stigma in general. And finally, pregnancy and regular prenatal care visits can make it difficult to continue education and work as usual.
So looking at some of the determinants we have listed here, we first can see that time and money place a barrier on the ability to obtain prenatal care, where teenagers most often do not have a steady income and spend most of their days at school. Stigmas are another determinant that surround teen pregnancy and can often lead to adverse mental outcomes such as stress, social isolation, and depression. Levels of support are another issue where pregnant teens with the lack of support are less likely to obtain prenatal care and more likely to experience shame relating to social stigmas. And finally, teens also practice riskier behaviors with underdeveloped brains where they do not have accurate risk perceptions on certain issues involving safe sex practices and pregnancy. As far as recommendations go, we believe that adding programs involving safe sex practices and the importance of prenatal care into school curriculums would be beneficial educational interventions. And additionally, tailored programs for already pregnant teenagers on the importance of prenatal care and partnering with local clinics to offer low-income prenatal options for teens are other recommendations we believe would make a huge difference.